Namaskar दोस्तों, welcome to channel Toxicology on Board. Today in this video we'll be discussing about another important topic, that is a DABT topic, that is carbon monoxide poisoning. So let's directly dive into the question. This question is taken from ABT recertification. So the question is, which of the following is not true for carbon monoxide poisoning? Okay, so we need to identify the options which doesn't fit into the characteristic property of this carbon monoxide poisoning. So we have option A. Option A is signs and symptoms will not appear in normal person exposed to 30 ppm regardless of the exposure time. So we need to identify with respect to carbon monoxide what is the amount of exposure of carbon monoxide which is going to cause signs and symptoms. So at 30 ppm, whether these signs and symptoms will appear or not. So this statement is uh, uh, true actually. An individual with coronary vessel disease. So this is normal artery. This is in the case of a coronary vessel disease. So we need to check whether the statement is applicable for carbon monoxide poisoning. An individual with coronary vessel disease is more prone to develop angina than a normal individual with a similar concentration of carboxyhemoglobin. So this option is also right. Later on, I'll explain in detail about the characteristic feature of the carbon monoxide poisoning. For the time being, in this first slide, we are just going through the question and options. In the absence of coronary vessel diseases, carboxyhemoglobin at concentration less than 10% saturation will result in increased coronary blood flow. So this statement is also true with respect to carbon monoxide poisoning. So we need to identify the here less than 10% saturation. Okay, then the relapses occur in persons recovering from acute carbon monoxide poisoning are more likely due to carbon monoxide storage in myoglobin. So there will be no storage of carbon monoxide in the myoglobin. So that is why this statement is not applicable for carbon monoxide poisoning. So this is a normal myoglobin in which you can see it is a single subunit protein will be there. Okay, whereas in the case of hemoglobin, four links will be there. Alpha 1 and alpha 2, beta 1, beta 2 links will be there. So go back and read the structure of this hemoglobin as well as myoglobin. Then 20% carboxyhemoglobin is associated with mild latex. So this is also applicable with respect to carbon monoxide poisoning. So right answer will be D, option D, which is in green text. So this is not a true statement with respect to characteristic feature of this carbon monoxide poisoning. So the relapses occur in persons recovering from acute carbon monoxide poisoning are most likely due to carbon monoxide storage in myoglobin. So this is not the right statement. So let us understand what is the explanation, further explanation which is given by the previous DABT students. So I got it from their notes. One of the most disturbing and unexpected aspects of this carbon monoxide poisoning is delayed onset of neurological symptoms. So in case of carbon monoxide poisoning, one of the target organ is CNS. Okay, so they will have neuropathy will be there. So there will be delayed onset of neurological symptoms you can find with respect to carbon monoxide poisoning. Why? Because there will be deprivation of oxygen to the two important organs, again CNS as well as heart. Okay, this syndrome sometimes called DNS. DNS is nothing but delayed neurological sequelae. So it is believed that CNS is related to brain lipid peroxidation. So there will be lipid peroxidation taking place in the brain after the exposure of carbon monoxide, which may be due to result of carbon monoxide triggering a nitric oxide formation in the bloodstream. So NO will be formed in the bloodstream after exposure to carbon monoxide. So this is a typical structure of a carbon monoxide. Okay, so this is in the case of coronary artery disease. This is a normal artery. This is in the case of coronary artery disease. So keep this picture in mind. Also keep this myoglobin and hemoglobin picture also in your mind, because in the subsequent slides we are going to discuss in detail about carboxyhemoglobin state, all those things. Okay. So let's understand what are the important signs of carbon monoxide poisoning. Here you can see headache, nausea, dizziness, breathlessness, collapse, and loss of consciousness. So if you look into a dose response curve, no, as the dose increases, the effect increases, or the duration of the exposure increases, the toxicity of that particular chemical exposure increases. So this is a very good explanation how right from the headache to loss of consciousness takes place. So carbon monoxide is a colorless, odorless, and tasteless gas. So another common name, it is called as silent killer. This carbon monoxide, no, it occurs whenever there is a burning of these fuels like gas, oil, coal, or wood. Whenever they are burnt, no, as a byproduct, carbon monoxide will be released into the atmosphere. And those people who are working in the closed areas, no, enclosed spaces, if carbon monoxide is released in such area, that will be lethal to that will be lethal within minutes. Adverse effects you can find. So what are the common symptoms with respect to carbon monoxide exposure is symptoms are often non-specific, so you will get confused whatever the symptoms which are there for fever, no, similarly like that of carbon monoxide exposure is there, so you will not be able to differentiate between even if a patient is showing certain symptoms, you will not be able to identify is it because of carbon monoxide exposure. So but only difference is there with respect is that there will be no increase in temperature. Elevated body temperature you cannot see in the case of carbon monoxide exposure. So symptoms are often non-specific and easily mistaken for either the flu or food poisoning, but notably they do not include a fever as I told. So we have four important things: mild exposure, moderate to severe, critical, at risk groups. Mild exposure, no, headache, dizziness, fatigue, nausea, and vomiting. Here you can see. Moderate to severe, confusion, chest pain, shortness of breath, blurred vision, loss of muscle control. Coming to critical, ear seizure, loss of consciousness. These are the critical exposure. Respiratory failure and death because lack of oxygen to the respiratory or to the lung tissues at risk groups. So we have special populations like fetus, infants, as well as adults, elderly people, and those which are having compromised conditions, heart and lung disease, they are more subjected to cause this carbon monoxide poisoning adverse effects when compared to normal adults, are more susceptible to severe damage. So this type of population. So whenever you are reading any chemical with respect to adverse effects, always look for special population, how this particular chemical is affecting the special population, that also you read. And as I told you, try to compare when you are reading those response curve as it is increasing, what kind of severe adverse effects are there. Okay. The next we'll see what is the immediate emergency action that a physician should do when a patient comes with a carbon monoxide exposure to the emergency department. First of all, you have to get into fresh air. As I told you, first you remove the patient from that enclosed area wherever such a burning or spill has taken place about carbon monoxide gas. Remove that person from that exposed area. Move everyone outside or at an open window if any disaster has happened. Call emergency service right away. Do not enter the building until it has been declared safer by emergency responders. So this is in the case of acute exposure or accidental exposure of carbon monoxide poisoning. What are the causes and sources? Carbon monoxide poisoning typically results from fuel burn. As I told you, either gases, coal, like that. So household items are there, outdoor equipment, vehicles. So vehicle exhaust also, they will release carbon monoxide. So go back and read. In my channel also I have explained about photochemical smog as a London smog, whether the carbon monoxide is part of that particular photochemical smog or London smog, that you read, because one of the question in previous DABT they have asked. Okay, then you pause the video and read about the causes and sources. Okay, then we'll see what are the prevention steps that can be done. And then install carbon monoxide detectors, annual inspections, proper ventilation, safe cooking and handling. So these are the precautionary steps that you can take. Okay, then medical treatment. This is very important from the toxicology point of view or emergency disaster management. In the hospital, doctors should confirm after doing blood test. No, they have to identify whether carboxyhemoglobin is there in the blood. Second one is how they have to start. They have to start the treatment with 100% oxygen therapy. Patients breathe pure oxygen through mask to flush whatever the carbon dioxide monoxide which is dissolved in the blood. It has to be flushed out of the bloodstream. Next, hyperbaric oxygen therapy. So this particular treatment, it have its own advantages and disadvantages. This has to be taken by the taken decision by the physician, case by case. But if the tissues are severely deprived with oxygen, then hyperbaric oxygen therapy is an option. Severe cases may require high pressure chamber to force the oxygen into the tissue and protect the brain as well as heart from permanent damage. So this kind of hyperbaric oxygen chamber will be there, but the patient will be put into, and this is used in the case of severe cases of carbon monoxide poisoning. So in this you can see, this is oxygenated blood, and this is carbon monoxide, which is dissolved in the blood, where you can see that the oxygen carrying capacity will be decreased. Okay, so along with this, no, we will also read what are the important pages in the Clayson textbook where carbon monoxide was mentioned. Okay, so in Clayson 9th edition, page number 10, that is comes under history of toxicology in that chapter. No, so this was a French physiologist, the scientist Claude Bernard. He was the first to describe the hypoxic effect of carbon monoxide. Okay, this is a important observation. I'm not saying any question will come on this, but with respect to textbook, we can learn about this particular thing on page number 10. And coming to chapter number 3, that is mechanism of toxicity in the Clayson 9th edition, Clayson short book, or you can read Clayson 9th edition also, but in short book it is page number 27, where again carbon monoxide was mentioned, and how the mechanism is taking place is that it is forming coordinate covalent bond with iron in various heme proteins. As I told in the first picture, no, hemoglobin, two alpha chain, two beta chains will be there, iron will be in between. So carbon monoxide will go and bind to this particular chain. So it is forming coordinate covalent bond with iron in various heme proteins. This also you have to remember. Okay, go back and read in this particular pages. Another important thing that you have to read in chapter 3, mechanism of toxicity, only page number 34, in which they have clearly mentioned about the agent. They listed out in table 3.2, they have given some examples where they are going to impair the mitochondrial ATP synthesis. So in my previous video also with respect to cyanide poisoning, I have listed the same table 3.2. Again I am mentioning because not only here see carbon monoxide, methemoglobin forming chemicals. Okay, here there was something with respect to phosgene. Okay, there was ergot alkaloids. So many even in case of cyanide it was there. Okay, so what you have to remember is that with respect to table 3.2 is that how carbon monoxide is going to inhibit the oxygen delivery to the electron transport chain. See, in the case of mitochondrial inner membrane, electron transport chain will be there, cytochrome C and various CAA, such kind of transporter chains will be there. Okay, so that particular mitochondrial transport chain is being interrupted, because of which ATP generation is decreased. As a result, oxygen to the most important tissues like brain and lung have been brain as well as lung respiratory system have been reduced, because of which tissue will undergo severe hypoxic conditions. Okay, so along with this in table 3.2 also read other examples how opioids like recreational drugs are causing interruption of oxygen delivery to the electron transport chain. Okay, also read about nitric oxide, NO2. As I told you, know, is it the component of photochemical smog or London smog? Also read about phosgene, which is used as a chemical war weapon in the case of World War II. This was used in the gaseous chamber also. So it was an important chemical weapon, war weapon in the case of biogas weapon in the case of in World War II. And other examples also you read with like ergot poisoning. With respect to plant poisoning, ergot alkaloids, how they're causing ergotism, which is another common name is St. Anthony's fire, where gangrene will be there with the. So here the sorghum is there, no, it has been contaminated with this ergot poisoning. It is called ergotism. So read in detail about these examples also. Then these are the then we will also read in Clayson short textbook only page number 57, that is chapter number 4, risk assessment. This will be there in 9th edition also, same diagram is there. So this is a very good illustration, perception of risk illustrated using a risk space axis diagram. So those toxicologists who are doing risk assessment, no, this picture is very very important. Okay, so on the extreme right you can see the red color, no, see risk space has axis that correspond roughly to hazard, perceived dreadedness, and to the degree to which it is familiarly observable. This in the upper right quadrant, this particular thing is there, no, are most likely to provoke calls for government regulations. Means this particular point examples, this quadrant examples are there, no, extreme right, red color. So these risks are no, they're not observable. So when you cannot identify the risk only, because in the case of risk assessment, first important step is risk identification, hazard identification. If you cannot identify the risk only, how you are going to mitigate it, or how you are going to avoid the exposure to that risk? So here you see, risk is unknown or those exposed, effect is delayed, exposure is there, there is no any adverse effects, then you will think that there is no risk, you will think, but the effects are seen delayedly. Okay, delayed. Risk is new, something a new type, for example, like COVID virus was there, which was a new risk was there, we don't know how to handle that particular risk. Risk is unknown to science. So like this, these are not observable type of risk. Some examples they have given, like radioactive waste, nuclear accident, reactor accident, diethyl silbestrol. They have listed these examples. If you have pause this video, try to read this example. So any question with respect to these examples comes in the exam, you will be able to identify and mitigate it. So these are few pictures I have kept. This is radioactive waste. So how the radioactive waste is disposed, that you read. This is about the radioactive disaster which has taken place in Chernobyl. So pause here, go back and read in detail Chernobyl, what are the nuclear particular important, like uranium, how it was leaked, and how to mitigate. If there is an uranium exposure, what kind of cancers are, like thyroid cancer will be there. So how you are going to mitigate it by administering iodine. So please go back and read in detail about this 1986 Chernobyl incident in and diethyl silbestrol accident which took disaster which took place. Diethyl silbestrol, the pregnant women who were taking this particular drug, after first generation, second generation, third generation, still their the daughters which were born with this diethyl silbestrol exposure, they have prone, they are subjected to have either vaginal cancer or cervical cancer. So read this also in detail about. Then there was this 1995 Tokyo attack in which sarin was the exposure. So again, sarin is again the one chemical weapon which was used in World War One as well as two. So which is a cholinesterase inhibitor. So read in detail this example also. There are now, if you look into blue color type of risk, no, these are uncontrollable, controllable type of risk we know, but we don't know how to, because whatever the risk is there, no, it is involuntary. We can mean we cannot know the initiation point, so we cannot stop the initiation, the trigger point. Actually, activity is dreaded, activity is globally catastrophic. Okay, it is not localized to one particular region. That risk is like pandemic, it is high risk of consequence of future generations. As I told you, example diethyl silvestrol, not only this generation or Chernobyl incident, not only to the exposure period to that particular decade, but for several generations, the type of high risk will be there. Consequences are fatal, so there is no recovery. It is a one way, that is unknown. It is an irreversible type of damage and fatal. Consequences are not equitable. Risk increase and is not easily reduced. So we cannot mitigate the risk. We cannot reduce the risk. So this type of are called uncontrollable type of risk. So they have listed some examples like carbon monoxide. Okay, you pause here and you go through the examples: nuclear war, nerve gas agents. For that example, I have given sarin. Okay, which in Tokyo, that a train disaster which has taken place where several people have died. Okay, then the pink one here we can see is observable type of risk. Here we know the risk, we are able to identify the risk are known to those exposed, effect is immediate, risk is old. So already the risk assessors are there, no, risk assessment toxicologists, they are familiar with this risk. So based on previous experience, they can mitigate the risk. Risk is known to the science. So already if we know how to handle the risk, it becomes much more easy to mitigate it. So for that also they have given some examples which are not too much serious risk. And controllable are activities voluntary. Here you can see uncontrolled activity is involuntary. If the activity is voluntary, if it is man-made or anthropogenic, we are creating that activity, we can stop at the initiation only. That is why it is activity is voluntary. Activity is not dreaded. Activity is not globally catastrophic. So if it is localized to one particular area or region, we can isolate that particular population or exposed area, or we can remove remove the population from that exposed area, from that spillage area like that. Low risk of consequences to future generation. So it is restricted to only one generation. Consequences are not fatal, means reversible type of adverse effects. Consequences are equitable, easily reduced and decreasing risk. So this type of risk can be easily handled by the risk assessor. So they have given some examples also. They have given oral contraceptives, nitrites, IUDs, diagnostic x-rays, vaccine, lead paint, etc. Okay, pause video. You can go back and read this particular figure 4-5. So any question, any type of examples, if you get across in your exam, you will be able to answer it. So next we'll see what important other pages are given in Clayson short textbook, page number 150, chapter number 10. They have listed in table 10.1 some developmental toxicology. They have given some human developmental toxicants, which the some agents or chemicals which are causing developmental toxicity in human. So we have our because our question is respect to carbon monoxide. So carbon monoxide is listed in a table 10.1. So carbon monoxide exposure to the pregnant population, it is going to cause developmental toxicity. So again, pause the video, read in detail. This same table 10.1 I have listed in cyanide video also. So read about aminoglycosides, how they are causing developmental toxicity, how the androgenic hormones, how the ACE inhibitors, example captopril, enalapril, how statins, angiotensin receptor antagonists, they are causing developmental toxicity, how the anticonvulsant drugs like diphenhydramine, trimethadone, valproic acid, carbazepine, they are causing developmental toxicity. Anti-cancer drugs like busulfan, chlorambucil, and cocaine, how they are causing developmental toxicity. Read the mechanism, identify, try to remember. Any question comes with respect to these examples, you will be able to answer in the exam. So again, read Clayson short textbook, page number 168, chapter number 11, toxic responses of blood. One statement is given: carbon monoxide has relatively low rate of association with deoxyhemoglobin. So something they are talking about oxygen dissociation curve. So with respect to mechanism of toxicity of this particular carbon monoxide exposure, you need to read about the dissociation curve, oxygen dissociation curve, partial pressure, because this is with respect to lung. So please read about PO2 as well as oxyhemoglobin percentage saturation. Again, I will read the statement sentence which is taken from directly from the textbook. Carbon monoxide has relatively low rate of association with deoxyhemoglobin but shows high affinity once bound. Once it is bound, it shows high affinity and causes a left, this shift in this dissociation curve. It causes a left shift in the oxygen dissociation curve. This is a normal one. It is showing left shift, further compromising oxygen delivery to the tissue. So major agenda is we have to decrease the oxygen delivery to the tissue, particularly your brain as well as your respiratory system, that is lung. Okay. So along with that, also read page number 243, Clayson short textbook, chapter number 16, that is toxic responses of nervous system. In this, how carbon monoxide is having adverse effects on your CNS. So they have listed in the table 16.1. Few of the examples, many examples are there. I am just focusing our video towards only carbon monoxide. So carbon monoxide, how it is causing neuropathies, neuronal injuries. Let's see what are the neurological findings, adverse findings will be there to the patient, no, to the victim who is exposed to carbon monoxide. Encephalopathy, delayed Parkinsonism, as well as dystonia. So what is this delayed Parkinsonism? We will see. It refers to the emergence of Parkinson-like symptoms such as tremors, rigidity, and slowed movement months or even years after the initial brain insult or the onset of related conditions. So this type of, there is first you have to read what is Parkinsonism, then also read about delayed Parkinsonism. In this case, what is happening in the case of delayed Parkinsonism? Chemical is there. If a person is getting exposed, but it is not, he is not showing immediate tremors or rigidity. After the exposure for a long period, after even after months or years, that time he is showing this Parkinson type of symptoms, then it becomes much more challenging to identify what is the cause for the for those symptoms. So that type of is called delayed Parkinsonism. Please read in detail. So what is the cellular basis of neurotoxicity? In this case is neural loss in the case of cortex. Okay, necrosis in the case of globus pallidus. Focal demyelination, always remember about the myelin sheath, Schwann cell, how the jumping of signals takes place, transmission of signals takes place, myelinated and demyelinated neurons. blocks oxygen binding site of hemoglobin and iron binding sites of the brain. So as I told you, brain and respiratory system are the important target organs in the case of carbon monoxide CNS toxicity. Along with that, pause here, also read other examples. Since we are already here, read about how aluminum metals like aluminum, arsenic, bismuth. There are three metals have been listed here. How they are causing the neurological adverse findings. Okay, for example, aluminium, it is causing dementia, it is causing encephalopathy, learning defects. Coming to arsenic, it is causing encephalopathy, peripheral neuropathy on chronic exposure. Coming to bismuth, it is causing emotional disturbances, encephalopathy, myoclonus. Also read about other two examples also, and read about cellular basis also, how they're causing. Okay, then here important thing you remember with respect to aluminum neurofibrillary aggregates. So this is seen in the case of schizophrenia or Alzheimer, that you go and identify. Okay, read. Then next we are going to discuss table 17.2, that is again carbon monoxide was mentioned in Clayson textbook only. I'm referring to short textbook page number 259. Read chapter number 17, toxic responses of ocular and visual system. How carbon monoxide having adverse effects uh, vi- uh, on your eyes. So table 17.2 they have listed common signs and symptoms of visual system dysfunction. So how the carbon monoxide is causing is, it is causing impaired color discrimination. So the patient who is exposed to this carbon monoxide, no, he cannot identify the difference between red color as well as green color. Okay, so what is happening, possible pathophysical basis is that acquired damage to the cone photoreceptors. So in the case of eye, you have photoreceptor rods and cones will be there, no? So there will be damage to this cone photoreceptors, neural retina, and an afferent visual pathway. Whatever the pathway is there, no, that has been affected by this particular carbon monoxide exposure. So higher level of chronic exposure to organic solvents, carbon disulfide, hexane, chronic carbon monoxide, chronic alcoholism, and ethambutol. So all these things, apart from carbon monoxide, read other examples. Try to remember, or exposure to these organic solvents will lead to impaired color vision. So in normal vision, a person can see this as green, yellow, and red. Whereas green, it appears to be in slightly like mustard yellow, like that. These are the difference between the normal vision and the color vision. Red also you cannot differentiate. Green also you cannot differentiate. Okay, and there was something else. There are some more type of examples are there. So read this is with respect to tunnel vision, which is the characteristic feature of uh, you pause the video and you yourself check. In this listed one example is there. That's why I kept this diagram over here. Tunnel vision is caused by which of the following examples? Mm, yeah, tunnel vision. Loss of perivision or tunnel vision. For this, I have kept this one. This is appears in the case of normal eye, but in the case of tunnel vision, the patient will see things in that. And for that, you try to remember the example methyl mercury as well as vigabatrin. Same examples are given for poor night scopic vision and impaired dark adaptation also. So try to pause the video. Try to read these examples, how they are affecting your, impairing your visual system and dysfunction. Okay. So along with that, you also read page number 288 in the Clayson short textbook, chapter number 18, toxic responses of the heart and vascular system, how the carbon monoxide is affecting your heart as well as your blood vessels. So carbon monoxide, it will induces focal intimal damage and edema in the laboratory, edema at what concentration? 180 ppm, to which human may be exposed from the environmental sources such as automobile exhaust, tobacco smoke, and fossil fuels. As I told you, know, it might be a component of photochemical or London smoke. You please go back and check. So whenever there is a car fuel combustion is there, no, automobile exhaust. So one of the effluent is carbon monoxide. So same thing you will encounter in the case of air pollution also, in the chapter also. Okay, short term exposure to carbon monoxide is associated with direct damage to the vascular endothelial cells. This is, and the first page also I have showed you this. In the blood vessel, vascular endothelial cells will be disrupted, and smooth muscle cells. The toxic effects of carbon monoxide have been attributed to its reversible interaction with hemoglobin. So this is the hemoglobin structure, alpha chain and beta chain. Okay, as a result of these interaction, carboxyhemoglobin decreases the oxygen carrying capacity of the blood, eventually leading to functional anemia. So carbon monoxide interacts with cellular proteins such as myoglobin and cytochrome C oxidase, elicit a direct vasodilatory response of the coronary circulation. So try to remember this also, which is given in the chapter Heart and Vascular System Toxic Responses, chapter number 8. Okay, so some additional information is given with respect to nickel. Whenever this carbon monoxide is combining with nickel, no metal nickel, so it is forming nickel carbonyl. So this is the one which is causing nickel carbonyl poisoning, which is given in chapter 23, which is comes under toxic effects of metals. On page number 354 of Clayson short textbook it is mentioned. So metallic metal nickel when combined with carbon monoxide, no, it forms nickel carbonyl. So immediately this nickel carbonyl will decompose it to form nickel and carbon monoxide on heating. So this nickel carbonyl is extremely toxic. Intoxication, some of the symptoms they have again important is cyanosis, okay, and it is causes leukocytosis, respiratory failure, cerebral edema as well as death. So pause the video and try to remember these nickel poisoning symptoms. Okay, then important thing with respect to toxic effects of solvents and vapors in chapter 24 it is given. So another organic solvent is there, methylene chloride, which undergo metabolism and it will form carbon monoxide. So we'll read in detail about this methylene chloride also. Methylene chloride, common name, another name is dichloromethane. Okay, is used as a solvent in the industrial process, food preparation, degreasing agent, aerosol propellants, and agriculture. So primary route of exposure with this particular solvent is inhalation. So industry, those workers who are working with this particular solvent, no, they are exposed through inhalation. Okay, systemic potential toxicity. It is this particular methylene chloride. It is rapidly absorbed and it is distributed throughout our body as a limited systemic toxicity potential once reaches into the blood circulation. High and repeated inhalation exposure produces slight reversible changes in the liver of the rodents. Okay, persons subjected to high vapor level manifest kidney injury. So kidney toxicity can be seen with respect to methylene chloride exposure. Carbon monoxide that is formed once this methylene chloride binds to hemoglobin, no, dose dependent increase in carboxyhemoglobin. This particular condition is induced in your body. Residual neurological dysfunction in the case of methylene chloride exposed workers has been reported. Those people, those workers who are working in the factories where they're handling this methylene chloride on a day-to-day basis, there will be a residual neurological dysfunction. The neuronal system, their function will be decreased. Occupational and environmental methylene chloride exposure are often concerned primarily because methylene chloride carcinogenicity in rat has been reported, in rodents has been reported, and it's a potential human carcinogen. So there is a possibility that it might also induce cancer in the case of human. Okay, so epidemiological studies, you do survey in the case of employees, no, exposed to this particular solvent have revealed that cancer risk from are very less when compared to other type of organic solvents. So also read page number, as I told you, know, since in this particular one of the major sources is from automobile exhaust, no, so that's why please read chapter number 29. In the air pollution also carbon monoxide has been listed. So carbon monoxide is classically toxicologically as a chemical asphyxiant. Please read what is the definition of asphyxiant. Those who are having difficulty in breathing and lack of oxygen to the lung, so because its toxic action stems from its formation of carboxyhemoglobin, preventing oxygenation of the blood but systemic transport. Okay, motor vehicles still account for two-thirds of this urban carbon monoxide emissions. Other sources are sites, tobacco, smoke, residential and commercial heating system, mobile auxiliary heating units. So these are the different sources of this carbon monoxide exposure as a component in the case of air pollution. And important clinical human health effects have been demonstrated. Below 2% you will not find, below 2% of carbon monoxide exposure you will not find any serious adverse effects. But whenever the carbon monoxide level in the breathing space has increased more than 40%, it will cause fatal asphyxiation. Okay, so pause here, try to read. This is a normal oxygenation of the blood. This is in the case of carbon monoxide poisoning. Okay, then in addition also read chapter number 34 in occupational toxicology. Also in table 34 too they have listed. So if you see in three places, see target organs, the occupation, these are some of the examples of occupational diseases and the toxicants that cause them. So carbon monoxide is listed under three organs. One is lung, one is nervous system, and third one is cardiovascular system. Already we have learned about eye also. That table also remember. But with respect to occupational means the workers who are working with this particular solvent or gas. So in the case of lung and airways, how this carbon monoxide is causing? It is causing asphyxiation. So try to read other examples also. Nervous system, how the carbon monoxide is affecting? It is causing parkinsonism. We have read about delayed parkinsonism, those tremors, and after couple of months or years of exposure you can find these symptoms. And with respect to cardiovascular diseases, this carbon monoxide is causing atherosclerosis. Okay, actually carbon it is also causing coronary artery disease also. In case of coronary artery disease, they are more susceptible to cause carbon monoxide poisoning. Okay, but I would request pause the video, also read about other examples like how the nitrogen dioxide, nitrogen oxide, how the phosgene, how it is affecting. Other examples, cotton dust, how it is causing. Asbestos silicose, how it is causing fibrotic lung disease. So here beautifully they have given listed out the examples. Please pause the video and try to remember the examples and the type of occupational disease. Metal fume femur, zinc, copper, magnesium. Okay, try to remember these examples. Okay, so thank you so much. Hope from this video we have listed out, we have learned and we have listed all the important pages or important topics or questions, areas, concepts where carbon monoxide there is a possibility of asking a question. So remember the target organ, what is the mechanism, how it is causing the toxicity. Also, if possible, try to integrate and read. Like read about methylene chloride, read about nickel carbonyl poisoning, read about cyanide poisoning also. Because cyanide poisoning mechanism was also similar to that of this carbon monoxide poisoning. In both the cases, carboxyhemoglobin formation is there. So deprivation of oxygen, shifting of this dissociation curve towards left side, all these things are there. Thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on Board. All the best for your exam.